Hello, fellow Redditors and all the ships at sea. I'm Jim N4BFR with today's COVID 19 update for Friday, the 17th of July. Let's pop up the report, and we're going to see 22,000 tests today, which is actually low compared to other days' data we've seen. Viral tests were actually only past 20,000, so that's about 20% off what we've been seeing on average. Nearly 1 in 5 tests were positive. 19.1% is the actual number, which means second highest day for testing or for cases since we've been doing this COVID-19 thing. Last Friday being the highest. We've had back-to-back relatively bad Fridays from a case reporting perspective. Going to jump to deaths first before I get into hospitals. Deaths were above average at 28. If you take a look at our average as far as daily deaths go, we are now over 20 deaths a day for more than a week on average. The 2 weeks before this, we had not eclipsed the 20 death per day mark, so we are continuing to see an increase in deaths reported overall. At today's average is actually 24 deaths, so put that in layman's terms. Every hour someone dies in Georgia from COVID-19. That's not a good thing. And when you count in pneumonia cases, which are not counted in this, but we have seen being significantly higher, it's probably more than that. All right, let's get on to hospitalizations. 301 new hospitalizations today broke that 300 barrier. Even though it was down from last week, it's still a pretty high number, and we're going to keep watching that. We have 2,902 beds in use. That is a new high, as we've been hitting new highs pretty much daily at this point. It'll be interesting to see as we come into the weekend. They try and get people out on the weekends, right? Not as many admissions as there are discharges typically on the weekends. So we'll see if that holds up there. A couple of new data points on the right here. You're going to see in purple CCU capacity greater than 90%. I wanted to list out the CCU areas that are having an issue, and we actually have, of 11 regions, we have 6 that are greater than 90% right now. Let me go ahead and jump to that report. The CCU report is showing the Athens area, the F area, which is kind of west central Georgia. That's the Macon area. We see Oconee coming down a little bit, but still at 90%. That's the Milledgeville area. We see Columbus at 96% now. We see the Shoreline area down Jekyll Island and those kind of things down to now in the 92% range. Tift Regional is at 96% capacity with only 3 beds left. We've heard a lot of reports, including one from NPR the other day, that they're basically saying Tift's full. So we'll see what else. Now, there is a hospital in Valdosta in that region as well, and that may be where those beds are showing up as, because Tift is the central point of hospital, but it is not the only hospital in that area. And then finally, Kennestone is at 93% as well. So 6 of 11 hospitals are in the 90% capacity range, something that we will continue to be mindful of as we go forward. I'm going to go back to the daily report for 1 second and show you another new area here. You'll see it now in the top right where I was showing a 10-day average. I popped that out, and I'm now using that for a White House guidance level. Lost in the fight between the governor and Atlanta mayor today was the fact that a report was published that showed what the White House, the data the White House is getting on a weekly basis regarding how each individual state is doing. They called it the governor's report in the release I saw. And as I went through it, they have very specific criteria for red and yellow status on how states are doing, and it's really based just on two metrics. So, because they're already things we are tracking, it was pretty easy to add this to the report. So, the first one is a reflection of cases per 100,000 population for the last 7 days. If we look at that number for Georgia, it's 225.8. So we are well above the 100 threshold to make that red. And I'll show you how we've been doing over time on that in a moment. The other metric is percent of positive cases. And as we know, because we track this every day, we've been in the 15% range regularly. We're at 15.7 today. This is simple math of how many new cases did we have divided by how many viral tests did we do. So over the last 7 days. So 15.7% there is in the red as well. Let me show you how that data is trending. Close that and open this. And here you go. You see these two metrics. I plotted them to see how we were doing. So if we look at the first one, which is new cases in the last 7 days per 100,000 residents, we have basically followed the spike since mid to late June, and we crossed right before July 4th, we crossed over that 100 cases per 1,000 residents, 100,000 residents metric, and now we are kind of closing in on 250. So that number is continuing to rise. Positive cases, percent of positive cases versus tests on the 7-day average. The really interesting part on this to me, no surprise that early on we had a high percentage rate because we knew we were only testing the most severe cases. And the cases that were actually showing up versus people who are who wanted to get tested. That improved, and testing availability improved as we got to March. But look at that data in late March, where it actually dips down below 5%, and 5% is the threshold to be out of yellow. And I guess that's green. It doesn't really say, but let's just say out of significant numbers at that point. So why is that data there? If you go back and look at the info in the history, that is the time period, those 15 days, when antibody tests were being counted as viral tests, and so it was reducing that denominator number of tests, or increasing the number of tests, which is impacting the percentage of tests that were positive. As we got to the beginning of June, they took that number out, and now we are rolling well up over 15% there, and we have been there for probably 20 days or so now, and that number is continuing to flatten out. So something that we'll be able to continue to watch on a daily basis, and I will pop this chart up over time as we go forward. So that's it for today. Remember, check out the Coronavirus GA subreddit on Reddit to talk about these numbers. There's lots of discussion there. I already see somebody, when I posted the chart, say that they're in a place where they're getting told to test less to maintain supplies. I think good news today is the governor said capacity will ramp up. Another 10,000 cases will, tests a day will be able to be conducted, so hopefully that will be a good number for us. But we'll have to see if they're going to stay at 15 to 19% positive rate. Then all we're going to do is find more tests and more cases in the base we already have and watch those numbers drive up. So we'll see how that comes online over the next couple of weeks. I'll be here all weekend, so keep chatting, keep asking those questions, and we'll see you over on the Reddit. And for now, have a great afternoon.